Verify fact checks the viral claims you see online. And by now, we've all heard that the Pfizer vaccine had an efficacy rate of 95% and Moderna 94%. What you may not have known is that stat's technical term. It's called the relative risk reduction. But some online are suggesting that we should instead look to the absolute risk reduction. Some posts pointing to this peer-reviewed paper, arguing that if you look at this statistic instead, the risk may only drop by a very small percent if you get the vaccine. So let's verify. What does that metric tell us, and why does it show the risk to be so much smaller than the other vaccine stats? We asked two experts in math and health, Dr. Stephen Kistler, who has a PhD in applied mathematics, and Dr. Ali Mokdad, with a PhD in quantitative epidemiology. So what is absolute risk reduction, and how is it different than relative risk reduction? In the context of COVID, Kistler explains that absolute risk reduction compares how much your risk reduces by getting a vaccine. For example, let's say there's a vaccine study where 100 people got the shot and 100 did not. And in the vaccine group, just one person got sick, whereas in the placebo group, 10 people got it. So let's break it down for person A, who got the vaccine, and person B, who did not. For person A, the absolute risk is 1 out of 100, because just one person got sick in that whole group. For person B, that absolute risk is 10 out of 100, because 10 people got sick. If you compare those two numbers, that's a 9% difference. Now let's talk about relative risk.
Relative risk is asking, what are my chances of getting infected relative to a vaccinated person?
For this, we compare our vaccinated person with our non-vaccinated person. So for person A, that's 1 compared to 10, or 1/10. For person B, it's a little less intuitive. You're comparing the number of people who got sick and weren't vaccinated to that same number, the number of people who got sick and weren't vaccinated. So that's 10 out of 10, or 100%. Think of it as a control group. When you compare those two numbers, that's a 90% reduction for those who got the vaccine.
That's a lot higher, right? So that's, and that was the issue that the paper brought up, was that the relative risk calculation in this case is a lot higher. And so what's right? What's correct? Should we be quoting 90% or should we be quoting 9%? Because those give you a very different sort of intuitive feel for the difference in risk that you get for being vaccinated. Well, I think both are useful.
Dr. Mokdad says that it's not at all unreasonable that the public is hearing about the relative risk reduction rather than the absolute one.
If I come to you and explain to you what's the absolute difference in lung cancer if you smoke, doesn't connect. But if I come and tell you if you smoke, there is 9 times more likely to get lung cancer, then that's a public health message. That's what we want, is we want to connect with the public. And we scientists have to speak a language that connects to the public.
Now, our Verify researchers did speak with the author of that scientific study that's been going around. He says that he believes that the public has the right to know both numbers. With our Verify, I'm Evan Kozloff.